Hello, and welcome to another episode of Celiac Straight Talk, the podcast where we can come together for a cure. I'm Claire Baker, Senior Director of Communications at Beyond Celiac, where we work toward greater advocacy for this autoimmune disease and accelerate research for treatments and a cure. Before we dive in, here's a quick word from our sponsor.
Fill in the blank. Celiac is seriously, what did you say? Frustrating, uncomfortable, isolating? Unfortunately, they all apply. The Illuminate 062 study is evaluating an oral investigational medication designed to break down gluten in the stomach, and participants are needed. To learn more, call 1-888-123-4567 or visit illuminatecd.com. To qualify, you must be 18 to 75 years old, have a biopsy-confirmed celiac disease, have been on a gluten-free diet for at least 12 months but are having ongoing gastrointestinal symptoms related to celiac disease, and not have another inflammatory gastrointestinal disorder such as Crohn's disease. All study-related care will be provided at no cost. A travel stipend may be provided as well. Right now, celiac can be described with words like restrictive, inconvenient, and stressful, but maybe one day it won't have to be. Call 1-888-123-4567 or visit illuminatecd.com.
Hi everyone, welcome back to Celiac Straight Talk. My name is Leah Popovic, podcast coordinator with Beyond Celiac. Today I'm here with Dr. Hilary Jericho, who is a pediatric gastroenterologist who works at the celiac disease program at the Lucile Packard Children's Hospital at Stanford. So we are very excited to have Dr. Jericho here today. My first question for you is just a little bit about your personal story. You know, how did celiac disease become a large part of your research and, you know, your focal point in your career?
Yeah, thank you, Leah. Thank you for having me and thank you for the question. So it has been a long journey for me. I think very, very young, I was always interested in working with children. When I was 14, I was actually diagnosed with Crohn's disease. I do not have celiac, but they're very like disorders in that they're both autoimmune. Your diet and lifestyle are a big part of keeping the disease under control. So they're very relatable conditions. And as I got older and moved through different stages of education, I naturally, I think, gravitated towards GI, given my own personal experience with it. And I had the opportunity to work with Dr. Stefano Guandolini, who is a very big name in the field of pediatric celiac disease at the University of Chicago. When I was there, he was inspirational. Celiac disease is such a unique and fascinating entity, and there's so much room for growth in it and knowledge. And so I naturally found myself gravitating towards it in his mentorship. I had the opportunity of working with him and Ritu Verma at the University of Chicago from 2012 until I took the job as the medical director for the celiac program at Stanford in January of this year, 2023.
I'd love to hear a little bit about the work that you actually do at Stanford. You know, how did this program come about? Were you a part of the coming about of this program at all? Or, you know, what types of responsibilities do you have? That kind of stuff.
Yeah, excellent question. Thank you. So I was not yet at Stanford when the initial idea of starting a celiac disease program began. It is under the header of Stanford Children's Health Pediatric IBD, so inflammatory bowel disease, and celiac center. Stanford was exceptionally lucky and is very, very gracious for a gift that was given to start the center, a financial gift. And that gift has really allowed for us to create an incredibly unique experience at Stanford in that we have a lot of specialty that we offer and individuals that have a focus in celiac. So with this gift that was given, it enabled us to bring in a program director for the center, dedicated researchers in both IBD and celiac disease, in addition to a great clinical group. And so we have a dedicated psychologist, a dedicated social worker, a dedicated dietitian, MAs, and physicians that focus on celiac disease, which is very unique and a really amazing opportunity that this gift has allowed us to create. Within this group, there's a lot of passion, a lot of drive. And so we together have now started moving forward with a lot of community initiatives, in addition to research and clinical initiatives surrounding celiac. My specific focus and main interest, I would say, is the psychosocial impact of celiac disease, meaning how celiac affects individuals' emotions, such as symptoms of depression, anxiety, and the like. And so we are getting ourselves off the ground now, but we had our inaugural event for the community in May of this year for Celiac Awareness Month. We have research symposiums that are coming up, and then I feel very fortunate that I received a grant to start a celiac specific mentorship program for our community. And so it certainly doesn't sum up everything, but those are some of the highlights of what we're working towards right now.
Great. And when it comes to, you said psychosocial is how you explained it, correct? Your particular interest?
That is correct.
And so through that research and what you've done so far, what are your findings? What is the link between, gastrointestinal issues and, mental health, depression, anxiety, and the like?
Absolutely. So I partnered with, her name is Kate Keenan. She's part of the psychology department at the University of Chicago. And we had looked at different validated surveys assessing anxiety, depression, coping skills in adolescents with celiac disease and how they relate to the gluten-free diet adherence. And our ultimate finding from that study was that there are exceptionally high rates of depression in our adolescent celiac patients that certainly we need to be addressing at a deeper level. And what I came to find is that, oftentimes I think a lot of our patients are nervous when they feel that way, that there's something wrong with them, that they shouldn't be feeling like that, and oftentimes feel alone and don't recognize this is a very, very common problem. So it's really opened my eyes to have closer follow-up with my patients, to not just sit back and hope people will tell me when they are having these feelings, but to more actively ask about it. At Stanford, we are through MyChart, which is an application that you can message patients. We have uploaded a number of validated surveys that assess for symptoms of anxiety, depression, coping skills that we are distributing prior to visits to really stay on top of this and recognize when this is a problem to ensure we are getting our patients the help that they need. So I think that study opened my eyes. And then a follow-up study that we are doing is looking at the impact of initiating the actual diet for families and how it leads to potentially feelings of food insecurity, perceived stress, and the ultimate hope with that study is to move towards legislation to potentially improve coverage of gluten-free food items for families through insurance, because this is the medication for patients with celiac disease. And as a medical food therapy, families should get coverage for it as any individual would for a medication that you get through a prescription. And so while there are options and you can do that, it is a very tedious process right now. And we're hoping to take the results from this study that's currently being executed and put it towards legislation to streamline that process, to make it easier for families to get reimbursement, with the hope that that'll reduce stress for families, reduce feelings of food insecurity, and improve the quality of life for families.
Join us at the Beyond Celiac Community Summit on September 30th, 2023 in Old Greenwich, Connecticut. This game show themed event is your opportunity to hear from expert speakers about celiac disease, along with a full day of swag, celiac safe food, and community. Tickets can be purchased at beyondceliacsummit23.fundraise.org. Again, that's beyondceliacsummit23.fundraise.org.
And what many people may not know is that a gluten-free diet is currently the only treatment for celiac disease, which I feel as though is very important to note, given all the research that you are doing. And here at Beyond Celiac, we're aiming to find a cure to celiac disease, but that won't come without the gluten-free diet hand in hand. With the celiac disease program at Stanford, are you and other people taking in patients through this program and kind of guiding them towards the lifestyle that they need to live to be as healthy as they can be with this autoimmune disease?
Yeah, absolutely. That's a great question. And we do have a clinic that's specifically called an interdisciplinary clinic. So every patient, every celiac patient that comes through our doors, we are trying to look at them as a whole picture, not just the clinical medical standpoint of you have celiac disease, you need to be on a gluten-free diet, but ensuring we're assessing all those different aspects. And so with our social worker and our psychologist and dietitian and myself, we have created a virtual educational series that'll be occurring monthly starting in September onward. That's really covering most of these bread and butter topics of celiac disease. And it'll be targeting our community and our patients. And the hope is to have some patient-run sessions as well, where people can share their personal stories and successes, in addition to having sessions where people can share their favorite gluten-free recipes and do little cooking topics. So we're hopeful that this, will target a lot of the areas that families struggle with.
And like you said, this program goes far beyond the clinical. It's all about also community and making people feel comfortable in their celiac diagnosis or other diagnoses. And you've been talking a lot about what the program is looking forward to accomplish. And you say you've been here since January, correct?
Correct. Just 6 months.
So in your 6 months, what's kind of the biggest stride that you and your team have made at Stanford? What's one thing that's really just fueled your passion to help others?
Yeah. Oh gosh, to pick just one thing, it's always hard. I would say the biggest areas that we want to further would be the celiac research, in addition to community outreach. And again, one of the things that we've been lucky to establish with this gift that was given is we have now created a biorepository and a celiac database. And the hope is we are already enrolling patients. So if there's any patients that are interested in participating that are listening to this in the California area, we would love to have you involved. We're collecting blood specimens, stool specimens, and duodenal biopsies from our celiac patients to be able to look further into research at the microscopic level, and use these samples to further our research. And so that's always an amazing opportunity when you are able to create these biorepositories. And then our database, just collecting patient data to be able to data mine, ask questions, get answers, again, to improve the lives of our celiac patients. So I think we're really lucky that we've been able to establish that, and we've had a lot of community excitement and families that have been very graciously enrolling into these databases. And then from the community standpoint, again, I think it's a lot of these outreach events. We had the big event in May. We had a number of talks, a large Q&A, and we feel very lucky that our community wanted to support us. And so we actually had a number of vendors come from the local 100% gluten-free restaurants to distribute goods. They got to share what they had to offer. Families got to learn more about the Bay Area out here and where are safe places that they can go and improve their knowledge of resources in the area. So we are hoping to have many more events. We got a lot of really positive feedback about that and a great turnout, which was exciting. But really to reach out to our community and understand the need and provide them with the best services we can to help them live the best lives that they are able to.
Absolutely. And how do you round up people to be involved with this, or how can people in the Bay Area get involved with this if they feel inclined?
Yeah, wonderful. Thank you for asking. So we always want to hear from people. We do have a email sign up list, both for our inflammatory bowel disease and celiac on our Stanford website. To read off the website to help you to get there, because we would love to have the community involved in our initiatives as much as we can. So our website is https:// so NED Stanford, STANFORD.edu. And then you can click through the links, or to get directly to us, it's a little bit long, but it would be /gastroenterology /patient_care /IBD_center. And that will take you to our IBD and Celiac Center website, where you can sign up for the emails to allow us to reach out to you about different clinical trials, research, upcoming community events, in addition to upcoming virtual educational seminars.
And these virtual seminars and this research that you've done, how can people, or do people have the ability to access it nationwide, or is this more just for people in the Stanford area?
Absolutely. So as I was saying, our hope is to start this educational virtual seminar series in September of this year, 2023. I will be posting about the upcoming events through social media. So we do have a Twitter site, we have an Instagram site, and we have a TikTok site. For Instagram and TikTok, they are housed under my account, but my entire center posts on it. The handle for those two sites are at Dr. so Dr. Celiac Queen, so Queen. And then our Twitter site is at B as in boy, D as in dog, _celiac kids. And there you'll be able to find announcements all about any upcoming events, research, clinical trials. In addition, we are through the Celiac Community Foundation of Northern California and on the website that I read off before.
Wonderful. And as the podcast coordinator at Beyond Celiac, I always do like to make the episode a little personal to the person who's being interviewed. So I guess I would just ask for you to share, what's the experience like to be so heavily involved in such critical research and science, and although it is your job, is it something that truly brings you joy and makes you happy that you can make a difference?
Yeah, and that's an incredible question, and it definitely was well beyond my job working with celiac patients. Again, I think coming back to my own personal experience with my own Crohn's disease and knowing what a major impact my diet and my lifestyle and exercise and stress levels have with control of my disease really drives me to want to be able to share my successes with others. In addition, I do have a daughter who does have anaphylactic food allergies to pecans and walnuts. And so we as a family are just very mindful about, food brought in the house, safety, what it means when we go out, how to ensure that we're always ordering foods that are going to be safe for her, that we're in safe environments. And so I think a lot of these personal experiences have really kind of molded the way I see things professionally as well. And I think because of that personal experience, it takes it well above just a professional level and this is my job, but something I'm very passionate about, just because not only do I want to have the safest and best lives for my children, but it definitely trickles into every other aspect of my life. And those feelings I have for my own family and myself, when I have successes, it makes me feel even greater when I can share those successes with others and help them to achieve similar success. And so, yeah, I definitely think this goes well beyond just a job. I'm very passionate about this, and it just really makes me excited when I'm able to help others, knowing that my family's gone through very similar things themselves.
Well, Dr. Jericho, I have brought up everything that I could have thought of, and you've covered every question that I've had. But is there anything else that you wanted to add? Something I might have missed? Anything about the center, about your experience?
Yeah, no, I think you've really covered just about everything. I guess the only thing I would just want to say is, even if the people listening to this podcast aren't directly my patients, I'm always happy to help in any way I can. So if any individual listening has any questions for me, if I could be of service, feel free to send me a message on Twitter or Instagram or TikTok. And I always try to be rather fast about responding and getting back to people, but I'm here to help everybody, and I want to make everyone's lives the best they can be. So, feel free to reach out, and I really appreciate you providing me the time to talk about our center and the direction we're heading today.
Absolutely. No, thank you for your time. It's been great speaking to you.
Thanks again for listening to Celiac Straight Talk. To learn more about life with celiac disease, visit our website at beyondceliac.org.